Hi friends, this is Dr. Abdequaem from Grace Healing Homeopathy. I hope you must have seen the video of Thalaspi bursa pastoris where I used that medicine for restlessness, a very interesting remedy where we don't study the mind symptoms and give more stress to the specific symptoms of uterine bleeding and all. Of course that is important, but a different view of Thalaspi. Today I'll discuss again a very important remedy in regards to female genital organs for bleeding, for menses and all, that is ERIGERON. Let me discuss first the case of ERIGERON. Normally what we think about ERIGERON is a remedy for bright flow of menses and nosebleed instead of menses, a remedy for metorrhagia with there is violent irritation of the rectum and the bladder, prolapse uterus. But I had a very interesting case, that lady had a problem. She was a lady who had a lot of fear, and the fear was so much, बहुत डरती थी, and the fear was so much कि when she was sleeping, she used to get up from the sleep because of frightful dreams. And that was a very interesting symptom which was told by her also and by his husband also. A lady having a lot of fear, and she used to get sad very easily, and his husband told me that as such there is no problem with the family, the children, and the lady also was very happy. She said, I have no problem, but still I have that fear. In past she had some problem of menses which was resolved, वो ठीक हो गया था, और उसके बाद उसको कोई सिम्टम ऐसा नहीं था पीरियड्स का. So we attributed maybe a lot of anxiety about the children education, the fees of the child, or the job of the husband. But the lady said, it's okay, but I am not so much engrossed and so much worried about that, because as such life is going absolutely fine. So I asked her, if you are very sad, for instance, what happens? What are the symptoms in the body? और उसने कहा कि see, when I become sad, I cannot think, मैं डल हो जाती हूँ, कभी कभी तो इतनी उदास हो जाती हूँ. Sometimes with sadness I am so weak. I am absolutely weak. I cannot do anything. I cannot get up from my seat also. I just want to lie down because of sadness. I am sad because of the situation, that why I have become so fearful, why I have so fearful dreams, and why do I wake up. And because of frequent wake up from the dreams, I am not able to sleep properly. So I get headache and lot of other things because of this fearful and this sadness character of mine. Of course, we had given remedies, 1, 2, 3 remedies. We prescribed lachesis, we prescribed lycopodium, we had sulfur, taking other symptoms into account. But these 3-4 symptoms were so very important, in the patient's totality, and every time the patient told me that also. So when I looked up to the rubrics and symptoms, that dreams frightful on waking. Dreams frightful on waking, we have remedies, we have lachesis, we have lycopodium, we have sulfur, belladonna, naxomic also, and I had prescribed 2-3 remedies, but it was not working. When I looked into other rubric, what the patient told, sadness with drowsiness, sadness with drowsiness, and sadness with prostration. मतलब इतनी उदास, so much sadness that the patient is not able to do anything. She is absolutely paralyzed. So much sadness. And when I rubricated these 3 symptoms, dreams frightful waking her, sadness with drowsiness, and sadness with prostration, the remedy which came in the repertory chart was ERIGERON, my dear friends, ERIGERON. I was very much surprised with the repertory chart, because she had at that time no symptom regarding to menses problem. Of course she had that, but it was not now. So with these symptoms I prescribed ERIGERON 1 mg single dose and waited for 15 days. She said she felt better. The frequency of waking with the dreams, which was maybe every alternate day, has now come up to maybe only in 15 days 3 or 4 times. I again repeated ERIGERON 1 mg, and now it has been 6 months. The patient is absolutely fine. She had in between that menses problem, bleeding bright red. I did not give her anything, and that was okay also. and the patient is cured now. This is the importance, again I am telling you, learning the remedies which are there in a mater medica, which are so much proved, but we are not understanding that they also have some mind symptoms which we don't read because it has so specific action on the uterus. If you open the mater medica, sadness with prostration, the remedy is ERIGERON and Rustox. Sadness with drowsiness, we have Calcaraphos, we have Murex, we have Coca, but we have ERIGERON also. So my dear friends, this remedy ERIGERON, if these symptoms are there, the totality matches, do think about this remedy ERIGERON. I have shared the case so that you can understand why I prescribe ERIGERON in which type of patient and which type of case. So it is basically both clinical and the knowledge of mater medica. We get a wider view of the remedy. My dear friends, if you like this video, do share and subscribe. Thank you.